Hi, I'm Scott Brown with Scott Brown and Associates. Today, we're going to talk about how adjusters use your medical records to reduce your settlement. Insurers consider your medical bills the primary claim valuation factor. Consequently, the adjuster will closely scrutinize your medical records, looking for ways to reduce your claim's value. In particular, adjusters will look for the following 7 red flags in your medical records. Number 1, are your medical bills proportional to your claimed injuries? Insurance adjusters look for consistency between the injuries claimed and the medical bills incurred. Adjusters develop a sixth sense as to when the medical bills are out of alignment with the nature and severity of the injury. Soft tissue injury claims, also called whiplash or low back pain, are prime candidates for buildup, a term of art among adjusters, which refers to the act of increasing medical bills incurred to artificially inflate settlement value. Physical therapy treatments that continue on and on with no reduction in visits and no appreciable improvement are also suspect. Number 2, where were you treated? In addition to the amount of your medical bills, the source of those bills will be important to the adjuster. In the eyes of an adjuster, a 2-week hospital stay and 3 months of physical therapy are much stronger evidence of an injury than a few $1,000s worth of diagnostic tests and adjustments by a chiropractor. Number 3, do your medical records suggest a lack of causation? Do your records include a notation about prior claims or injuries? Is there any mention of a pre-existing condition or an injury to the same body part? Is there reference to intoxication, alcohol, or drugs? Does anything in your medical records deviate from the official account of the accident that has been represented to the adjuster? Number 4, is there a correlation between the medical records and the treatment received? Adjusters become suspicious if the medical bills submitted lack corresponding medical reports. Those reports validate the diagnosis made, treatment given, and future prognosis. If a medical report does not accompany each set of bills, the adjuster may discount or even disregard those charges. In medical malpractice litigation, it is often said, if it's not in the chart, it didn't happen. Some adjusters take the same approach to evaluating medical expenses. If there isn't a medical report to go along with the bill, it isn't worthy of consideration. Number 5, what is the quality of the medical information provided? Fill-in-the-blank medical reports are viewed with skepticism. Narrative reports from well-respected doctors explaining the nature of your injuries in descriptive detail are best. Hospital records with detailed nurses' notes are also excellent sources of information on your injuries. Number 6, what did you tell the first doctor you saw after the incident? Expect the adjuster to scrutinize the medical records of the first caregiver, focusing on the history given. If that history says nothing about an accident or attributes the injury to a pre-existing condition, expect adjuster resistance. Number 7, what is the reputation of your treating doctor? Is your doctor known for specializing in treating patients with insurance claims? Does your doctor advertise for personal injury victims? If so, the doctor's credibility will be suspect, as will the validity of your claim. To recap, are your medical bills proportional to your claimed injuries? Where were you treated? Do your medical records suggest a lack of causation? Is there a correlation between the medical records and the treatment received? What is the quality of the medical information provided? What did you tell the first doctor you saw after the incident? What is the reputation of your treating doctor? If you have any questions, we are available to discuss your situation. Please call us today at Scott Brown and Associates.